My name is Angie Carpenter. I am the supervisor of the town of Islip, and delighted to be here in the town of Babylon, and so disappointed that town supervisor Rich Schaefer is not able to be here, but he's been so supportive and a wonderful host in a lovely town board room with a great speaker system, much better than ours, but we're working on it. So good morning, and thank you all for joining us as we gather to bring awareness to breast cancer education, early detection, and the survivors whose journey to recovery we celebrate. And there are a few people I would like to acknowledge here. First of all, Nicole Mosca from Northwell and her entire team, Angela and everyone from Northwell. If you would all stand and be recognized, we'd appreciate that. Thank you. And we also have Terry Prague from the Babylon Breast Cancer Coalition. And I know the Islip Coalition is also supporting, but I don't think they're here yet. And of course, someone who has been here each and every year and so supportive of this initiative, and that's Jerry Compitello, who's the Babylon Town Clerk. And I certainly want to recognize a gentleman who serves with me on the Islip Town Board who took the time to be here, show his support, and that's Councilman Jorge Guadron. Councilman, very handsome with your pink tie. Thank you so much. I am pleased to again stand shoulder to shoulder with our neighbors to the west, the town of Babylon, and Supervisor Schaefer, and the Northwell Health community, as we mark a month-long campaign to help save lives and bring awareness to a disease that affects about 1 in 8 of U.S. women and a growing number of men. Long Island, as you know, has a long history battling breast cancer. It was next door in West Islip, my hometown, where the first ever breast cancer mapping project was born, spearheaded by West Islip resident and breast cancer survivor Lorraine Pace, and her husband John, who joined forces. I don't think he had much of a choice with Lorraine, but it really became a team effort with the both of them. Their crusade spread nationwide and abroad, lighting a pink spark that the world over would become the breast cancer environmental movement and mark a fundamental shift in how we talk about and address the issue of breast cancer. Today, the town of Babylon and town of Islip communities further that movement and marshal our joint townships, neighbors, and community members to stand with us throughout October and each month of the year as we fight a signal in the community affirming that together we can save lives. I think everyone here today can relate to someone they know, whether it's family, a close friend, or colleague, whose life has been touched by cancer. I know my mother-in-law many years ago had breast cancer, and it was certainly far earlier than any of the awareness that came out of the project that I spoke of with Lorraine. And someone I served with on the Suffolk County Legislature and Supervisor Schaefer too, and that was Suffolk County Legislator Cameron Alden, a man who is a breast cancer survivor and very much committed to the cause. So, you know, like, what can we do? It certainly starts with early detection, which is the best prevention. It starts with spreading the word, providing education on all preventive measures and the signs and symptoms to look for, and that's what we're doing today. And it starts with hearing from and learning from and sharing the stories of those whose battle continues, the patients, the survivors, and their family members. It starts here. So let's get started. And I'd like to begin by inviting Rob Labiento, who is the Director of Health and Wellness for the town of Babylon, to say a few words. Rob?
Thank you. All right. Hi, everybody. My name's Rob Labiento, and like Angie said, I'm the Health and Wellness Director for the town of Babylon. First off, I would just love to thank Pink by the Bay, Northwell, the Babylon, and Islip Breast Cancer Coalition, and all the specialists here today, and the experts that put this event together, and all the great work they do all throughout the year, not just on the single day. Next, I would love to thank Supervisor Rich Schaefer and the town board for hosting us today, especially Jerry Campitello, thanks so much, as well as Supervisor Angie Carpenter and her Islip staff for all this great support that they've given us in partnership throughout the years. Most of all, though, I would like to thank our breast cancer survivors, their family and friends for coming out today and helping us support, educate, and actively participate in their health and the health of the community. When we set out to do this health and wellness program for the Town of Babylon employees, Supervisor Schaefer had one really important goal in mind, and that was to make every single Town of Babylon employee healthy and happy. And that was a feat easier said than done, but we were up for the task, all right? But we wanted to create a program that was comprehensive, fully integrated, and easily accessible, and one that really promoted a health-conscious culture, right? So that was really important to us. And in doing so, what we did was we found 4 core pillars. We set upon 4 core pillars, and those are physical fitness, mental health, nutritional support, and medical attention, all right? And I'm very honored to be here today to take part in an event just like this that really embodies these 4 pillars, these 4 core values, and we deem them so important in the town. So we've also taken a page out of Pink by the Bay's book, all right? We really look to support, educate, increase awareness, and really use those preventative practices to make sure that our town employees are healthy and happy physically and mentally. And cancer does not discriminate, and our health and wellness is a journey. So these important events like today, they're amazing, they're great, they're powerful, but they also remind us that it's not one day, it's not one screening, it's not one doctor visit, it's a continuous effort throughout the year to take an active role in our health and wellness. So please today, please educate yourselves, but also if you haven't yet, get a screening, participate in a screening. It's very important. And again, my name is Rob Labiento. I want to thank you guys all for being here today, sharing your morning, your afternoon with us. If you have any other information that you need, help, guidance, questions, please reach out to us. All right, the Town of Babylon is here for you guys. Not only do we want to be strong, safe, and resilient, but we also want to be healthy and happy. So thanks so much for being here. Join us for a workout today. I look forward to seeing everybody. Thank you.
Thank you so much, Rob. And thank you for your passion. You can see how he is very inspirational for sure. I'd like to now invite Bridget Smith, a patient and survivor, to come forward and please share her story. Bridget?
Thank you. Hi, everybody. So I am somebody who's been getting mammographies for many years. I have a family history. My cousin, when we were both 26, was diagnosed with breast cancer. So it just was something that motivated me to go get my baseline and just follow from there, where most people don't start getting them until they're older. So I've been fine for many years, no issues. And then in November, I went for a mammography. I had started going every 6 months for the last year and a half because there was a certain spot that they were watching. And I started getting mammographies coupled with sonograms. So in November, I got my mammography. And then they said, oh, we want to do a sonogram on both breasts. So I said, okay, I didn't know we were doing both, so we did both. And then they said they needed to do a biopsy, which is really like an earth-shattering thing to hear somebody say. But it went well. I have to say Northwell was wonderful. I've been going to them. I'm a labor and delivery nurse in Northwell at LIJ currently. And the support from everybody there has just been great. So the biopsy went great. I went and I had to have a biopsy with an MRI, which was another thing that's very stressful. When everything came back and I was told that it was cancerous, I work in labor and delivery, so I have access to very good doctors. And I immediately text my OB, who sent me to Dr. Karen Kostroff, who is here today as well. And it just worked out. They gave me a couple of names. She just happened to be the first person that I called, and they got me right in, and she was amazing. I couldn't get in for a couple of weeks, I think, and she was so wonderful. She called me herself just to reassure me and talk me through the findings. So my breast cancer was caught very early, which is why I encourage people to go and get those scans. I just made my mom sign up for a mammography, which she hasn't had for many years. So I pushed her into that today. But it was caught very early. When I met with Dr. Kostroff, we were able to come with a plan to do a lumpectomy and followed that with radiation. I had to wait for some testing, an oncotype, which will tell you the likelihood of the cancer returning. And depending on that score, it determines if you need chemotherapy as well. My score, lucky number 19. So I did not need chemotherapy, but I had a lumpectomy in June, and then after about a month recovery, I started radiation at Imbert in Bayshore, and I did radiation 5 days a week for a month there. The girls were phenomenal. Everybody, everywhere along the whole way has been great, and they were very supportive. I actually almost missed the girls when I finally stopped going to Imbert. But I've been doing great. My recovery was fine. My lymph nodes were all clear. And now I'm on tamoxifen for the next 5 years, tolerating it just fine, following up with my doctor as ordered. But I just really want to encourage everybody to get your screenings and just stay on top of it and be healthy. So, thank you. Thank you.
Bridget, thank you so much for being willing to share that story, really, of inspiration and hope, and hopefully prod everybody, if you haven't gotten your mammography, to please do so, because early detection, you know, she's the success story that we will hope for. So it's really important as we continue from and hear stories like Bridget's, both for education, but again, to let us all know that there is a reason to have hope. I'd like to ask Dr. Karen Kostroff, who is the Chief of Breast Surgery at Northwell Health, to please come up and say a few words. Doctor?
Bridget, thank you for coming forward. And that's sort of what this is about. This is about paying it forward. We are clearly trying to give the message. If you think about it, if you're a parent, you would do anything for a child. If you're a child, you would do anything for your parents. So by taking care of yourself, and we can't prevent this disease. Yes, we have some tools to reduce the risk of it, but ultimately we sadly still cannot prevent it. So since we can't prevent it, almost 80% of breast cancer, if found small on a mammo, on a sono, on an MRI, will allow you to go down a pathway that is less rather than more. Right now in the world of breast cancer, we have moved to tremendous what we call de-escalation. So many patients are just having tiny, minimal outpatient lumpectomies. We're no longer doing lymph nodes as frequently if found small or at a certain age. As far as radiation, it used to be 6 to 7 weeks. Now it's 4 weeks in a certain age group, and if you're over 70, it's 1 week. And then finally, the use of chemotherapy, which is an example. We have a tool that's widely used that looks at the aggressiveness of the tumor. It's the best phone call I make. I can call, and if the number is low, and it is in 80% of the time, it means that you won't benefit from chemo and you will benefit from just hormonal treatment. And so for all those reasons, literally everyone here today, if anyone is behind on their mammo, call. If you're having a trouble getting an appointment, call me. Sorry, Amy. If it's all again bad. Recently I had a patient who she was diagnosed in all my years, I've seen incredible combinations, mothers, daughters, husbands, wives, everything. Two other sisters went for their imaging, and they both had cancers present at the same time. So, yes, it's no one wants this diagnosis. I'm as vulnerable as all of you. We're hoping I go in, I'm going to be fine on the coming out, but it's going to be what it's going to be. We can't control it. We're all equal when it comes to that. But it is about taking care of yourself, but therefore taking care of your family, because you do go for this test, and not be so afraid. The afraid is because people tend to delay. That's when we'd have to do the bigger surgery, the increase in treatment, the lengthier treatment. So I hope everyone here today will call a friend, and find out if they're behind, or if they're not, whatever it will take to get someone to go is what the message is. There's no financial screening by law is covered in New York State, so there's no financial barrier there. We have screening mobile units. We have transportation, anything that can potentially be a barrier. I think we can break that barrier. So, and then the care. I adore working at Northwell. I've been here 37 years. The team is just truly, truly amazing in what they do and how they take care of people. Bridget, as you mentioned, I've heard that before. People don't want to say goodbye to their radiation team. It's nuts, but it's true. Same thing with the initial imaging team. If you need a biopsy, patients have called afterwards and say they were so supportive, so compassionate, so involved. And there's also something called the CARES Act now, which means information is supplied very quickly. You have portals to learn. You need the support to learn, but it's out there. So let there be no barrier, please, and consider going. And I thank all of you who have come out, and the great Northwell team that comes out for this and encourages people and educates people. Oh no. Thank you.
Thank you so much, Doctor. And it gives us really that reality check. This is there. It's not going to go away, but there are tools, and don't let anything be a barrier, as the doctor said. And that's where the coalitions come into place, transportation if you can't get there. You need somebody to stay with your kids. You need somebody to help you at home. The breast cancer coalitions, both Babylon and Islip, we are very, very blessed. They are so dedicated. They really, really, really do a fine job. So with that, I just ask everyone to please take advantage of the free health screenings and continue to share the information about Pink by the Bay initiative. The doctor said, when you leave here, it's not just you and what you heard. Call a friend, call your family, just help spread the word. We can do it. All through October, our communities will shine in pink as a visual reminder for all that this issue is serious, this issue is pervasive, but so too is our resolve to champion awareness while we continue to drive towards a cure and remind everyone that there is hope. So thank you so much for being here. I thank Rich Schaefer and his team here at the Town of Babylon. Jerry, thank you so much. Rob, you guys do a fine job. And certainly to Northwell, we really appreciate all your efforts. Thank you.